Hey everyone, it's Amelia. Welcome back to my presentation on self-harm. If you've just joined us, I'll leave a link over here to the start of the video, but let's get going. Treatment is hard. For most people in the depths of self-harm, if you just straight up take them to see a specialist, they're likely to shut down and make further treatments harder. They have to want to get better. Self-harm is one of the strangest illnesses because it's something that you often don't want to be cured from. Yes, you want to not have to hurt yourself to feel better, but you often cannot picture what recovery will look like, so you think it can't happen or is unattainable. For treatment to be effective, you have to tackle the root of the problem, e.g. why they have self-hatred rather than why they hurt themselves. As treatment progresses, rather than being forced not to harm themselves, which only causes more pain, anxiety and pent-up emotion, treatment should focus on the client not feeling the need to harm themselves anymore, and that is a sign of good treatment. Creating a new coping strategy is often great during treatment, as relapses are very likely, so the client can use the strategy rather than going straight back to self-harming. I mentioned a few different strategies which I didn't find as effective as a straight replacement for self-harming, but are great in the treatment process when you're actively trying to stop self-harming. Writing your feelings, expressing yourself and drawing, exercise is a great tool, distraction techniques like watching your favourite TV program or listening to music. When I was in hospital, I would go and lie outside at night, when I was most vulnerable, on the lawn. I'd put my earphones on, listen to my favourite music, and just watch the stars. Forced myself just to lie there and do nothing. It was so hard at first, but the practice of just doing nothing I found eventually like a release. Even if it doesn't make things better, it's relaxing, it's a positive experience rather than the negative self-harm. Reading is good, but often people struggling with mental health cannot find the concentration to read and comprehend a book. So the mind will continue to wander, and a wandering mind is a sign that the coping strategy is ineffective.